We are starting spinal anatomy. So we're going to be taking a look at the spinal column. The spinal column is composed of 33 vertebrae. 24 of those actually articulate, which just means they move around. We're going to have 7 cervical right here at the top. These top 2 are special. This is going to be atlas and axis. This allows for head turning. Okay, right here, this is actually a vertebral artery. This is where chiropractic adjustments can actually get into trouble, where you tweak this. I was going to say twerk, but we're not going to twerk the neck. You tweak this a little too hard and it can actually get pinched, and that can cause a stroke. It's something to be aware of. A lot of people don't know that's even a risk with manipulation of the neck. And that includes even when you're doing it yourself, you're not usually as aggressive when you do it yourself. So 7 cervical vertebrae, 12 thoracic, 5 lumbar, and 9 that are fused together into your sacrum and your coccyx. An easy way to remember that is breakfast, 7 o'clock. Noon is lunchtime. 5 o'clock for dinner, and 9 o'clock is bedtime. I suppose that only applies if you're a certain age. I'm 42, so that's pretty much my schedule as long as my kids are cooperating. This is not a fragile structure. It is not a string of pearls. It does not fall apart. It isn't even actually injured that easily, despite what you may see and hear from all manner of practitioners. This structure is one of the best examples of stability, strength, and flexibility in nature, in anywhere. So, and when we look at these, in between here is actually bracing with ligaments. There's another one here called the nuchal ligament that connects all of these together. And then there's another one on the front. There's actually separate pairs of ligaments that connect each body here to the rib. And it all becomes this sort of symphony of motion. And then on top of this is actually layered muscle, like tons of muscle. We just throw up a picture, actually. That's easier. The last thing, because I was unaware that people did not know this, that your spinal column or spinal cord does not run down these big sections. It is actually through the vertebral foramen, which is this tunnel that's composed of these processes that come off the back. Okay, so the spinal cord actually sits inside there, and that is how it is protected. All right, guys, if you have questions, you know where to ask.